The David and Goliath of the healthcare revolution, when private practices and physician-owned hospitals returned fire.
They sent you on mission trips. And one of the trips was a medical mission trip. And so we spent a significant amount of time trying to get down the Amazon, get on a couple of bush planes. Took us about 5 days. Lo and behold, I'd never seen something that you guys know a lot about. I'd never seen a portable surgical center. I watched about 25 physicians and about 7 dentists do some work that will make any grown man weep. And that's really what started the journey was, hey, there's a big need and lots of asymmetries exist. And this is what I want to fix. I sat with a retiree yesterday. The practice paid him $2.2 million to retire on his exit. And I just thought to myself, you worked for bleepity bleep 30 years in a practice and you're getting $2.2 million when you walk out. Like I thought, well, what a travesty. We also have to take care of patients and we also have to start making some of that money.
What are the problems? There's a lot of market concentration. You're right about this. And
Yep.
a lot of regulation that favors the Novas and the MedStars and the Northwells
Sure.
of the country. In Virginia, it's basically impossible to open up a standalone surgical center because the big health systems like Inova and Carillion down south and Centera will block you.
What you have, let's call it 10 to 12 rules or laws, federal laws and state laws that essentially hand the business over to the larger health systems. Now, the good news is there are solutions to all of these challenges. Our health system stinks. Everybody's paying too much for coverage.
Do you think that will be good for your political future?
I don't think listening to a liar speak and say it over and over again makes it true. All these health systems just use their market power to destroy the little guys. And the little guy calls United and goes, I do a really good job and I'm really trying to lower healthcare expenses. And I just want $400 for my MRI. And they go, suck it, man. We don't care about you. And we don't want anyone to go to you. They'll complain about their costs. They're lying. They've never done any cost accounting ever. I am an accountant. I know cost accounting when I see it. They want their costs to go up. They want their prices to rise. And because they want premiums to go up. Who at CMS decided that this was going to be a good deal? Right? When I look at the individual who runs CMS and then look at the attorney, if you could call them that, at HHS, I go, these people made these deals for typical Washington reasons. They want jobs after they leave office. What's also sad is there's no lawmakers on the Hill, and I'm on the Hill every month. There's no lawmakers on the Hill going, like, why can't we pressure CMS? They have no power over CMS whatsoever. The only thing that changes this narrative is competition. And the only people keeping markets in healthcare from being competitive is the United States government, the lawmakers who get lobbyist dollars, right? Because that's all those guys care about. If you're them, this is the greatest deal. I wake up every day with a big grin on my face going, we're just taking money like it's candy. These people have absolutely devastated the market and we have to get it back. Every single person in healthcare knows that physician-led practices have higher quality outcomes and lower prices.
And physicians can't own pharmacies and physicians can't own hospitals. Hey, the hospitals can own physicians and the insurance company can own physicians, and there's no conflict of interest.
Everybody knows these are lies that will be told. We just have to stand up, be a pragmatic society and go, oh, if it's enough, we're not taking this anymore. This is madness. I started forming coalitions with all the independents in different states. And so what that looks like is you have a practice and like in New York, let's say between Long Island and North Jersey, right? Like the summits of the world and Jersey City, you've probably got 4,800 independent physicians, right? And so we're uniting those under one umbrella, only for the purposes of payroll, benefits, and all the other insurance lines. Guess what happened when we put them all together in one coalition?
You have a big force. You have a gang.
And so it's a Braveheart that you said, unite the clans. And I'm like, no, unite the physician. Like the best thing we can do is cooperate where we can and then compete where we can to make sure that the patients are treated appropriately. Every single doc is an owner in this organization. Every single one.
Anybody that's in business that has an IQ of 5 buys vaccines through a GPO.
It's also how people buy medical supplies. It's how people buy lots of equipment that you might need for your practice. This is not really about the robot in the office. This is really about, we have problems retiring. We have problems attracting new docs out of med school to private practice. We have problems with margin compression. We have problems with carriers. So how do we, and then we have regulatory problems. Why would any employer want to do business with this academic health center when 80% of the population of those employers utilize these independent practices?
I just wrote a report for our practice and I said, if you do this, you will make another $800,000 a year.
Yep.
It's not illegal. It's not bad medicine. It's just changing one process in your lab. Do they own the business or do you own the business?
The butting of heads really creates the beauty of disruption in healthcare. These tech people just go, I know everything. I'm an all-knowing God myself.
Yeah.
Oh,
They don't ask anybody that knows any question.
Cookie cutter, zero mistakes, Toyota assembly line procedures do not work when you're taking care of humans.
I hope people understand the nuance and the beauty of what you said, which is no one's the same. And we treat every single person as an individual patient.
At a system level, you got to make a meeting to make a meeting to make another 5 follow-up meetings with a bunch of people from nursing to the directors to the whatever, and make no progress.
You guys are scientists. Let's solve these problems and not worry about like how much money is it going to cost, or what are the outcomes, or what is this, or what is that.
Replacing the knee is wonderful because you can walk again, but knowing who's not going to be a good candidate for a knee replacement and who is and who is ready is what makes an excellent surgeon versus an average surgeon.
I think it works fine at scale. I don't see any employers that are in all 50 states that can't make it work. And if they can't, then just go, you're just doing it wrong, because it's totally a scalable enterprise.
The money, rightly so, just like they did with the COVID vaccine, was put for innovation and hospital care to keep you at the end of life from dying in the street. There is no longer people in their 60s dying in the streets of Chicago because they can't access care. When you're doing 30 patients a day, you're not doing the best quality. It's just impossible.
Look, let's be clear. Every innovation starts with rich people first,
Yeah.
right? It goes from wealthy to rich to middle class to the poor.
Humans are idiosyncratic. They'll go to the doctor when their knee hurts, but they won't go to the doctor to be told to lose the weight and do an exercise program before their knee hurts.
The average person who came to that clinic had not seen a physician in 7 years. No medical appointment. And the number one reason they gave is because they saw a price and they knew what the exchange or consideration was going to be.
All the contracts from the managed care companies forbid you from disclosing your fee schedule. Now that's hard to enforce because the Trump administration made it so all the hospitals have to disclose what they're getting paid for all the procedures, including their doctors that they hire.